Dr. DeAun Nelson, and I invite medical professionals to listen as I discuss how shifting the focus off of weight in healthcare can greatly improve health outcomes for patients of all sizes. I will explore what it means to practice in a weight-inclusive paradigm and discuss tools to implement these ideas in practice. Keep in mind that the information I will present may be new to many of our listeners and may sound radical to some, but stick with me. This information could change the lives of your patients. In today's episode, I wanted to dive into options for treating patients that do not center on weight change. Significant and permanent weight change is nearly impossible for the majority of the population. And while some conditions could be exacerbated by more weight, certainly disease and disability don't discriminate, and really neither should we. We need to take a little bit of our focus off of getting people to lose weight and move it on to getting people healthier, which does not always include weight loss or change. So I wanted to go over some definitions initially, just some terms that people may not have heard of or might be a little bit unclear as to what they mean. And these are kind of my definitions. So there might be other people's other definitions, how they might think of it, but this is how I think of them. So these are my definitions of these terms for the most part. And the terms that I'm going to be talking about are pretty similar, but I think that the differences are important to delineate. So the first term is weight neutral or weight independent. They can kind of mean the same thing. Basically, they mean that assessment and treatment is made without focusing on the number on the scale, which is kind of like you wouldn't focus on somebody's eye color or height or hair color if you are addressing their treatment and assessment, right? So basically taking weight and putting it into those categories of just physical attributes. I have personally started to use weight independent a little more often instead of weight neutral lately, because I see weight neutral as not really taking into account how weight affects people's lives. Not physically necessarily, but societally, and then how that can affect their health. We talked about weight stigma and weight bias and how those things can affect people's health. So, regardless of what you do, they're still going to have that going on in the background. I always want to take that into account. It's kind of like when people say that they're colorblind and they don't take into account the person's race. That sounds great until you realize that part of that person as a whole certainly includes their skin color and their ethnicity, and that they are affected by those things. And so to just ignore it entirely doesn't allow you to see the whole person. And I feel like that's an issue around saying you're weight neutral. But weight independent I like a little better. And I like the fact that we can really recognize that society is having an impact on people's health, and it's not just what they're individually doing. It's much more than them individually. And I'd like to just be clear as well that weight loss is not the answer to the social stigma. Addressing the social stigma is the answer. So I've started to, like I said, prefer weight independent over weight neutral, but weight neutral gets used a lot. So I wanted to just kind of delineate that. The other term that I'm interested in talking about really quick is weight inclusive. So when I think of weight inclusivity, it basically kind of means that people of all sizes are welcome in your practice, and that you are somebody who's going to understand, how weight stigma is affecting people, and you're going to use that knowledge in your interaction with patients, again, trying to modify it as much as possible, cut down on it as much as possible in your own practice. It also indicates that you're not going to tell people to lose weight, and that's not going to be your first treatment plan. It also would tell people that your office is prepared to welcome people of all sizes, so you have a facility that can accept people of higher weights, including, chairs and exam tables and blood pressure cuffs that will fit. So I tend to say that I have a weight inclusive practice and that I treat in a weight neutral or weight independent way. Hopefully that makes sense. Now that I've talked a little bit about those two terms, I wanted to talk a little bit more about some established weight-independent approaches to health, because I'm not certainly coming up with this on my own. I'm smart, but not that smart. So there have been some studies about weight-independent health changes, but they're not that numerous, and I would attribute that to the fact that they don't make people a lot of money. They're not contributing to the $60 billion weight loss industry or the pharmaceutical industries. Why would we do research on that where people are actually learning to be healthy? Well, whatever. Anyway, studies have been done, and they do show that there's a lot of promise using weight-independent approaches to health to actually make people healthier regardless of weight change. And that's really exciting. So Linda Bacon actually wrote the book called Health at Every Size, which is one of the first things I'm going to talk about today. And she also co-wrote updated version, I guess you could say, with Lucy Aphramor, who's a registered dietitian, and they wrote a book called Body Respect. They also collaborated on a review of non-diet approaches to healthcare called Weight Science, Evaluating the Evidence for a Paradigm Shift. And I will include that in the show notes. In their paper, they reviewed the studies that had been done at that time and evaluated the results. And basically what they found was that the studies where body positive and weight neutral approaches were applied, they had lower recidivism and better and longer term health changes regardless of any weight changes. And in fact, most people didn't have significant weight changes over the long term, even the people who went in to lose weight. And then the people who actually learned sort of like healthy approaches and they were not encouraged to lose weight generally had health outcomes that, or health benefits that stayed around for a lot longer, even though they didn't have any weight changes. The fact that there was a low recidivism rate also, I think, is really something important to note, because in many weight loss studies, especially the few that are longer term, they have quite high recidivism rates, and I suspect that a lot of that is due to the fact that people gain the weight back, and so they drop out of the study. And it's definitely something to think about when you're researching and looking at these studies. You know, who's coming back and what changes are actually being made and how much weight are they actually keeping off and how long are these studies. Something else that they found that was really interesting is that how a person feels about their body affects their health, regardless of their body size. And I think we might have talked about this a little bit in the last episode. But basically that means, like, if a thin woman and a fat woman, and I'm using thin and fat as descriptors here, both have body discontent, so they're unhappy with their body, it will actually affect their health negatively. So even the thin woman, who many people would say, oh, she's healthy, even if she's doing things that are healthy for herself, if she feels bad about her body, it negatively affects her. This would indicate that shame around body size does not create health improvements. And in fact, shame would tend to discourage favorable lifestyle choices and would tend to have a negative effect even for those people who are doing things that are healthy for themselves. So certainly we know that shame does not help, and we're finding that it actually can do harm. And I'd like to quote a quote within a quote in the article. Quote, a common aphorism expressed in the Health at Every Size community is that, quote, if shame were effective motivation, there wouldn't be many fat people, unquote. I've always thought that that was a very profound quote, because when society and the medical community holds up one body type as the ideal, that really encourages shame and discontent among anybody who doesn't have that body type, and can even encourage shame and discontent in somebody who has that body type but is afraid to lose it and then lose that privilege. That actually will lead to the things that we're trying to avoid, which is poor health, right? And a lot of people often think that shame is the way to go, and it's just more and more being exposed as a very poor motivation technique. So often when the term health at every size is brought up, it's actually misunderstood. Many people who initially hear it think, oh, it means that they think that everybody is healthy at every size. And that's not at all what it means. It means that health and movement toward health, so doing positive, healthy things for yourself, is possible regardless of your size. So you can have somebody who is, thin and healthy. You can have somebody who is fat and healthy. You can also have somebody who's thin and unhealthy and someone who's fat and unhealthy. Making assumptions about somebody's health by their size really just shows your bias towards their size rather than anything about their health. And of course, as medical professionals, we do have access to people's health and we know what their health status is most of the time. I mean, if they're our patients, obviously, if they're not our patients, we don't know. And we need to keep that in mind, that that's what we're moving toward, is moving toward health and not trying to pigeonhole them into a specific BMI or a specific body size or waist circumference. We want to make sure that they're doing things that are supporting and helping themselves. And that's what I think of when I think of health at every size. So I want to go over the principles of health at every size as outlined by the Association for Size, Diversity, and Health. And they have actually trademarked the name health at every size. So if you use it, put a registered trademark on it. The principles there are 5 of them. And the first one is weight inclusivity. To accept and respect the inherent diversity of body shapes and sizes and reject the idealizing or pathologizing of specific weights. That's exactly what it says. And again, with the weight inclusive healthcare, being able to look at all of your patients and accept that there's a variety of sizes and those sizes are never going to be pigeonholed into one. And again, rejecting the idea of pathologizing or idealizing specific weights can help us cut back on shame and cut back on expectations of certain sizes that may or may not be healthy for certain people. The second part is health enhancement. Again, a quote, support health policies that improve and equalize access to information and services and personal practices that improve human well-being, including attention to individual physical, economic, social, spiritual, emotional, and other needs. So again, health at every size here is going beyond physical health and really wanting to pay more attention to things beyond the physical health and beyond what the patient can do to improve their health. The things that we can do to support our health are just a very small part of the things that affect our health. Health at every size really has a broader view of wanting to create better health policies and create a society where people can thrive at all sizes. And certainly addressing more than just physical health, but also mental and social and spiritual health. The third point is respectful care, which is to acknowledge our biases and work to end weight discrimination, weight stigma, and weight bias. Provide information and services from an understanding that socioeconomic status, race, gender, sexual orientation, age, and other identities may impact weight stigma and support environments that address these inequities. So again, we're looking at more than just the individual, and we're looking at how their various identities may be affecting their health. We need to really focus on making some changes that are going to create better health in our society and better health. And I don't mean individual health. I mean working to end, racism and sexism and all the isms so that we can actually have a healthier base for all of our patients. And that certainly includes sizeism. The fourth point is eating for well-being. To promote flexible, individualized eating based on hunger, satiety, nutritional needs, and pleasure, rather than any externally regulated eating plan focused on weight control. So basically, no diets, right? They're focusing on what individuals need, what their bodies need, and not imposing external rules on them when it comes to food. And the fifth point is life-enhancing movement. Support physical activities that allow people of all sizes, abilities, and interests to engage in enjoyable movement to the degree that they choose. And this is something that we haven't talked about as much. We've talked about movement, but I haven't talked a lot about the impediments to movement and exercise, and I will actually probably have an episode that will either include that or talk about it entirely, a whole episode. There are often impediments to especially larger people being able to get the exercise that they need. Oftentimes going to gyms can be demoralizing and upsetting. There's often a problem with finding clothing that fits, especially for those larger people who are very active and are athletes. Finding clothing that works the best for them and their desired sport can be very challenging. Being able to help patients find resources, and then, working within our communities and within like finding people that we know, or, working with companies to help create, clothing for larger people. And I don't mean just going up to a size extra large. And then also creating spaces where folks can go and be comfortable when they exercise. And then also addressing, physical limitations. And there are certainly plenty of people of all sizes who have physical limitations to exercise. And so not pigeonholing our ideas of exercise into a particular thing like walking or running or biking, because not everybody can do those particular sports. Certainly I hear all the time, all you need is just a pair of shoes and your legs and go. But, what about people who are in wheelchairs or who have, osteoarthritis in their legs and in their knees, and they have a really hard time walking. So we need to be creative and understanding with our patients to find movement that is helpful and appropriate for them and makes them feel good and doesn't hurt them, so that they don't want to go ever to move again. Basically, as we've talked about this in past episodes, that our health is, and I've talked about it already today, that our health is not entirely dependent upon our personal actions and choices. HAES is the short term for health at every size. Basically encourages looking beyond the individual's health to the larger societal health, and that will in turn help everyone get healthier. The thing to remember is that even if someone is doing everything that they can to promote health and promote their own health and doing all the healthy habits, they may not lose weight. Some people might actually gain weight. Some people might not lose or gain. They just kind of stay about the same. Maybe their bodies will change, but the weight doesn't change. And those that gain weight may actually have been artificially keeping themselves below their set point. I just can't stress enough keeping in mind, as your patients make health changes, to encourage them not to have any specific expectations, and encourage yourself not to have any specific expectations around how much weight they're going to lose or what body size they're going to be. Ultimately, their body is going to go where it needs to go and where it feels most comfortable, and they can still be strong and healthy and really vibrant and have a great life, even if they still weigh more than you expect. The next thing I wanted to get into a little bit is intuitive eating. There's actually a book called Intuitive Eating. It's written by Evelyn Tribble and Elise Reich, and I'm sorry if I've mispronounced your names. They're both registered dietitian nutritionists. And the focus of the book is to help people move away from restrictive eating that's focused on external rules and focusing on internal body cues, which I've mentioned a couple times already. Typically, we can separate people into controlled eaters or intuitive eaters. And I'd like to say that neither is better or worse than the other. It's like how people are. But moving toward internally motivated eating often really helps relieve anxiety around food, and it can be really helpful long-term for people with disordered eating and eating disorders, and it can take some time. Some of the characteristics of controlled eaters, and often you would think of people who are dieting in this group, they tend to count calories and think carefully about what they're going to eat and the consequences. They rely on external cues to regulate eating, so rules, diets. They often feel guilty when they eat something that wasn't on their plan, which in turn can cause shame, which is not helpful. The constant preoccupation with food uses up willpower, which reduces performance, so it can affect other parts of their lives. I just like to remind you of the Minnesota starvation study. Though this is not necessarily these people are restricting, but they certainly are concentrating on food a lot, and it can cause problems like I said, in other parts of their lives. And when our willpower is lowered, our hunger and reward systems kick in and get us to eat again. Again, when we talked about diets not working, there's that problem that willpower is not sufficient to allow us to continue dieting. And if we are going beyond what the calorie needs of our body, then our body will kick in at some point and make us eat. And also have the reverse effect. If we eat too much, our bodies tend to kick in and tell us to slow down a little. Some of the characteristics of intuitive or unrestrained eaters, they use internal cues to determine when and how much to eat. Often, if you think about children, they are often intuitive eaters, and they kind of eat when they need to eat and don't eat when they don't want to eat. They tend to eat as much or as little. I mean, I'm sure all of us have experienced at least one child who will not eat for days, and then they're fine and they eat fine, or they'll eat a whole bunch and they have a big growth spurt. So we can learn a lot from kids as long as we don't destroy their internal eating habits. They're less likely to eat emotionally or indulge in binging behaviors. As we discussed in the last episode, restriction tends to lead to binging behaviors. People who eat intuitively tend to not restrict themselves so much, so they don't tend to fall into the need to binge. Generally, they do stay at lower or stable weights, and regardless of the amount of weight they have on them, stable weights is generally going to be more helpful for their health. Even if you're staying at a higher weight, but you're staying at a stable weight, that tends to be better than yo-yoing up and down. So certainly, intuitive eating and mindful eating can be something that really can help people stabilize their weight and feel better about how they're doing and get healthier. One big fear that I've noticed a lot of patients and practitioners have is that if people stop dieting and stop watching what they eat all the time, then they will basically just eat and eat and eat, and they'll gain weight forever. And generally, this is not found to be true. Of course, we'd be focusing on doing healthy behaviors, which includes eating a variety of foods and doing movement. And when people do this and they don't have calorie restriction, over time that they find that their weight will stabilize, they'll also find that they don't have as many cravings, or they don't want to eat and eat forever. I mean, they might initially eat a bunch of stuff, but that definitely slows down after a while, and they generally will start kind of eating a little more, I don't want to say moderately, but thoughtfully, and eating what is best for their body. And again, when we focus on healthy behaviors, we don't want to focus on calorie restriction. We want to focus on just healthy behaviors and getting enough food, especially making sure that they're eating enough calories for the things that they're doing and taking care of their basic body needs. So what I look for is, has my patient's weight stabilized? Are they eating a variety of foods and getting enough calories and nutrients with their foods? Are they moving their body regularly? Which, can be an issue. We live in a society where we sit a lot and we sit behind our desks all day. And so, being able to get up and move their bodies is really helpful and makes most people feel better. And not necessarily getting up, but moving your body in some way. I just talked about that earlier. And then, are they feeling better, right? Are they feeling better in their body? Do they feel stronger? Are the aches and pains not there so much? Or if you hopefully have addressed whatever is physically going on with them, is that improving? If a patient's weight is stabilized, really the concern about it really just moves to the bottom of my list of thoughts. If their weight suddenly changes, then it moves up in my concern list, because it should probably be addressed. Generally, significant quick weight changes, either up or down, certainly could be a symptom of something else that's going on. So the easiest example is if somebody loses weight suddenly, you might wonder if they have cancer, right? So these are times when you would say, oh, hey, there's some significant weight change and they're not doing anything different. What's happening? And then you would investigate that, but not tell them to gain or lose weight. It's not uncommon for people who are moving out of the diet cycle to have a period of time where they're going to be maybe moving less because they're associating exercise with like punishment for eating, or maybe eating more because they've been restricting certain foods, and so they potentially could indulge in those foods a little more than they would normally. And this is really normal as they work to figure out their hunger and fullness cues and what their body is really asking for, and there any cravings they might have, and really allowing themselves to emotionally eat things that maybe they have been restricting in the past, and physically eating things that they may have restricted in the past. In fact, I often tell people to figure out what thing they desire the most and that they are afraid of the most, and keep it in their house. And what I have discovered is that over time they get to where they desire it much less, just because it's always there and they know that they can have it at any time. I know I've experienced that. And I have much less fear around food because I know I can have whatever I want whenever. And so I often don't want the things that I used to, be afraid of, or that I used to binge on or have, eat a lot of, because I'm just like, oh, I can't ever get this again. And now I find that I eat those things, but I'm not overly concerned about them. And a lot of people will discover that over time. And so it's really normal, really, really normal. And during this time, it might be helpful to have a Health at Every Size trained therapist and or dietitian on board to help with that transition. Just kind of help for them to talk to the therapist and kind of figure out some stuff. Because I know in your office, if you're a medical doctor or another type of physician, you're not going to be able to chat with your patients about this for very long. It's really great to have some support in that. And then it's also really important for you as the medical provider to not freak out a bunch. So you're creating a safe space for them to go to get back in touch with their bodies. And so many people are out of touch with their bodies for so long that it's going to take some time. So, being encouraging and, letting them know, hey, you're doing a great job. Yeah, just encouraging them and, creating a safe space where they can go and be okay. The main goal with eating is to encourage patients to move toward being the more intuitive eaters, which I talked about earlier, and eating according to those internal cues instead of the external food rules and the diet rules. And something that I've noticed, and you will probably notice as well, is that, and I'm not the only one who's noticed this, is that when people are moving towards intuitive or mindful eating, they want to know if they're doing it right. And this can be really difficult because there is no right way to do it. It's whatever works best for them, right? Again, that they have those fears, that probably you as medical providers have. What if I'm doing it wrong? What if I eat chips and cookies for a month and die of malnutrition? What if I gain weight? And honestly, that stuff may happen. Well, not the getting it wrong part, but they might eat cookies and chips for a month, but they're probably not going to die. If they have something like, a metabolic disorder or diabetes or something, you do certainly want to make sure that they're not, screwing up their meds or screwing up their insulin, of course, but giving them that time to figure out what works best for them is really important. And certainly, people survive on not eating, quote unquote, the perfect diet. There is actually a fair amount of latitude for the majority of people. And then it's just our jobs to make sure that if they have any sort of conditions that might be negatively affected by certain excesses, we just make sure that they're taken care of and we support them through that journey. So instead of telling them to lose weight, we support them to figure out what works best for them. The next thing I wanted to talk about is a program called Well Now. Lucy Aphramor, who I'd mentioned before, who had co-written Body Respect and the Evidence for a Changing Paradigm paper, started a program called Well Now, and her program is a weight-independent approach to health, and it has a strong focus on body appreciation and caring for one's body in a body-positive way. And she would actually explain this so much better, and hopefully I'll be able to have her on as an interview at some point. Hi, Lucy. Actually, last year, the NHS and the Scottish Highlands started using her program to increase health in their area, and it's going to be a 2-year program, and I'm really excited to see what happens after 2 years. Since it just started pretty recently, we're still gathering data, but I think that it will make a huge difference in outcomes, especially with mental and emotional health, but certainly with physical health as well. And something that Lucy also coined the term, well, at least to me, kindful eating. And when I think about intuitive eating, and I think about especially going through that period where you're kind of getting used to it and trying to break away from that diet cycle and that diet mentality, that perfection mentality, I think it's such a great term to use. And so being kind to yourself and encouraging your patients to be kind to themselves when it comes to their eating and their movement and their health habits, and understanding that this takes time, and shame is not going to help them. So being kind to themselves is actually going to be much more supportive of their health and actually help them make better choices ultimately for themselves. And hopefully that kindness will also spread a little bit. So, my idealistic side says if we're all a little kind to ourselves, maybe we'll be kind to others, and others will be kind to others, and so on until we actually have a better society. But maybe it's just me. That's the kind of world I want to live in now. She also reminds us that people have different access to health promoting things. So again, not everybody may have access to healthy food and fresh food. There are certainly plenty of food deserts in the United States for sure, and in the UK, I imagine, and in many other countries. We have to remember that. And again, people may not have access to safe places to exercise or feel safe wherever they're exercising. Again, I had talked about the possibility of somebody not being able to comfortably go into a gym or walking and things like that. When we address health promoting behaviors, we have to take into account individual and community access to those behaviors and to those healthy things. And Well Now definitely, just like Health at Every Size, but even more so putting focus on addressing societal behaviors that affect health and beliefs that affect health. And I think that those are very important things. Certainly done a couple episodes about them. So hopefully everything I've talked about so far has given you an idea of kind of how to maybe start thinking about your larger patients in particular, but really thinking about all your patients and their weight. And I just wanted to acknowledge that I know most of us have been taught during our training and by our society and obesity researchers that fat is bad, and it's always bad, and it's always unhealthy. I mean, the AMA made fatness a disease in and of itself, so that's the culture we're living in. And I know that there may be many of you who even get to this episode and are like, still not sure about this. But I would like you to just consider that maybe I'm right for a minute, and consider how, if I'm going to be taking my focus off of my patient's weight and not prescribe weight change as a treatment, what am I going to do? I would say that it's actually pretty easy. For example, when you have a larger patient come into your office, stop and consider if weight loss is your first idea for a treatment plan, maybe even before you know why they're there. Is that the first thing you think of? And if it is, I just encourage you to try to put it aside for a minute. Set it aside and listen to what they have to say and listen to why they're there. And if it's weight loss, find out why they want to lose weight, because there may be something else there that they need to address. And then when you start considering treatment, one of the things that has helped a lot of my colleagues is just thinking about what you would do for that person if they were thin. Because again, most diseases and disabilities do not affect just fat people. They affect thin people as well. And we generally do not tell thin people to lose weight. If somebody comes in with knee pain, don't just automatically assume they need to lose weight. Find out why they have the knee pain. And they may have even had the knee pain since before they gained weight. Maybe they gained some weight because they couldn't move as well, because they had knee pain. Always ask these questions. I know it sounds really simple, just doing what you would do for a thin person. And that's because it is. But a lot of people don't consider it. And I think that just being able to consider it can make a big difference. We've just been taught that weight loss is the first defense against disease. And it's not your fault that that's the way we've been taught to think. But you can think other ways. And certainly many, many physicians over the years have thought in different ways and made huge, important strides in medicine. And I think that this could be one of those huge, important strides that we make in medicine when taking the focus off of weight and putting it on health. This really goes beyond individual healthcare providers. We're encouraged to have our patients change, and we forget about society. And I know I've talked about that a bunch today, but really starting to address our own weight bias and looking at the weight stigma in society and looking at healthism, again, all episodes that you can go back and listen to, are things that can contribute to poorer health in ways that the individual can't control. But as medical providers, we can start making those changes, right? So part of our job shouldn't just be not doing no harm, but also trying to remove the harm that's being done outside of our offices. I can't change the medical system by myself, and thank goodness I don't have to, because there are a lot of people that are working to start making it a better medical system. But if we can get together, history has shown over and over again that a few people can change society for the better. I really hope that y'all will be on board with me and start making changes, not just with your patients, but in your offices, in your hospitals, in your physician groups, your associations, and just getting people to think and getting people to really delve deep into their thoughts and beliefs around weight. Yeah, it's important. I'd like to thank you for listening. Hopefully we'll be doing a little more focus on individual things. I'd love to really talk about some individual conditions and diseases and things that we can really talk about how weight affects them or doesn't affect them, and how we can really delve into the research behind it and really get some good information, and then also practical information about how to make your office a safer place and a more inviting place for people of all sizes. I have lots of ideas, and if you have any ideas, please let me know. If you are interested in being on the show, or you think you have something interesting to share, or if you know somebody who might have something interesting to share, feel free to email and let me know. I'm very excited to start next year. Our next episode is going to be a discussion about the fat acceptance movement and the body positive movements as social activism for better treatment around people of all sizes across society. So it's a little less medically oriented, but I think it's still very important to know that these movements are out there and, starting to create a better society for all of us. So be sure to tune in. The theme music you're hearing was composed and performed by Galen Davis. If you enjoyed the podcast or learned something new, please subscribe